We now turn to the Department of Medicaid. Since coming into office in January 2019, our administration has been evaluating our Medicaid program. Department of Medicaid officials have traveled the state. They've spoke to hundreds and hundreds of Ohioans who are covered by Medicaid to better understand what their actual experiences with Medicaid have been and what their health outcomes have been. We've also met with physicians, hospitals, healthcare providers, managed care plans to hear their ideas about how we improve the delivery of healthcare and the health of Ohioans. From these conversations and this process, we have developed a new plan, a new vision for Ohio's Medicaid program, one that focuses on people and not just focuses on the business of managed care. A vision of what we hope will be a better, healthier, more productive state of Ohio. This is the first major overhaul of Medicaid in 15 years. In the coming days, the Department of Medicaid will be rolling out a series of requests for applications for managed care plans to submit to us to help carry out this vision. So this process will be rolling out in the next few days. The Department of Medicaid is the largest provider of health insurance in the state of Ohio. Medicaid covers 3 million Ohioans. Of those, nearly 90% are enrolled in a managed care plan, including nearly every child enrolled in Medicaid in the state of Ohio. That's why what these plans do is so very important. Tomorrow, a new application will open for those businesses interested in providing managed care plans for children and adults within the Medicaid program. The selected plans, the ones that are selected, will be an essential piece in improving the health and lives of millions of Ohioans. Not only will selected plans work with my administration to build better systems of care, but they also play a special role in helping their members develop good health habits, such as using primary care instead of the emergency rooms, getting needed vaccinations, and attending prenatal visits for pregnant women. They'll also help to coordinate care for individuals with more complex health needs, ensuring that patients see their specialists and take their needed medication. Medicaid's new program will focus on all of the following. 1, improving care for children who have complex needs. 2, it will emphasize the personalized care experience of the patient. 3, improving wellness and health outcomes, getting in front of the problem, focusing on wellness. Number 4, giving doctors and other medical providers more time to spend with patients, and patients having more lengthy conversations with their doctors. I think that is very important. Next, increasing transparency and accountability across managed care to improve members' care and experience in making sure all recipients understand what their prescription drug and their other benefits actually are. Let me make one thing clear. If you're watching this and you're currently covered by Medicaid, please know that any changes to Ohio's managed care plans will not disrupt your coverage or your access to care. Another announcement that I would like to make is that the Department of Medicaid will issue a second managed care application letter later this fall to specifically serve children who have complex behavioral health needs. On any given day, thousands of Ohio children are living in treatment facilities because they struggle from severe mental illness, substance use disorder, or a developmental disability, sometimes all three. Sadly, many of these children are from Ohio's foster care system. Almost half of teenagers who are in foster care over the age of 15 live in a residential treatment center. Children's experiences leading up to and in the foster care system can leave them with trauma and other significant behavioral health needs. In fact, nearly 2/3 of all Medicaid spending on Ohio's foster care youth is for behavioral health services, showing that their mental health needs far outpace their physical health needs. For some youth, their needs are so intensive that we don't have the types of care within the state of Ohio that meet their needs. In fact, today, 140 of our Ohio's children are currently receiving care outside the state of Ohio, placing them sometimes far away from their families, their homes, and their communities. Clearly, we're not doing these children and other children in need of care justice. They and their families deserve better. Our new managed care program for these children, which we are calling Ohio RISE, R-I-S-E, will work to build up evidence-based care coordination and behavioral health programs throughout the state, ensuring access for more children and better outcomes for those children. We certainly will not see changes overnight. This is a process, but we begin that process today. And I'm confident that these new programs will help to make Ohio a healthier, more vibrant state.